So back pain and sciatica in some rare cases can lead to paralysis or loss of function in your legs. Now this is rare, but we do need to be very aware of the symptoms and things to look out for to make sure that this is not you, because if you've just got back pain or sciatica, that's fine, we can give you exercises to fix that problem. However, if it's something more serious and it is creating what we call cauda equina syndrome, then that could lead to paralysis or a loss of function in your legs. Now here is what to watch out for. So the discs in your spine, they can bulge or prolapse and they can bulge out to the side, putting pressure on these nerves, which will send pain down the leg. That's sciatica. You could also have disc damage, which bulges out, doesn't necessarily press on the nerve, but it still causes a lot of pain in the back. That's very common and that's fine. However, if you're getting a certain few symptoms, we need to be watching out for those, because that in the long run could create a loss of function in your legs. Now here is what to look out for. The disc can actually bulge directly backwards rather than being out to the side, and that will put pressure on your spinal cord. So when the disc bulges backwards, pressure on the spinal cord can actually create a loss of function in the nerves that shoot down the legs, which is a medical emergency. You must get to the emergency room straight away, because if that pressure is left on those nerves long enough, then you will lose the function in your legs for good. And that's not what we want, obviously. So the three things that we need to be looking out for is, number one, you need to make sure that you've not got saddle anesthesia, which is basically a loss of sensation in the nerves or the area underneath here where you would sit on a saddle. If you've got pressure on the spinal cord, creating a loss of sensation in the saddle area, that is one thing that you do not want. The second thing is a loss of bowel and bladder control. So the pressure coming directly backwards onto the spinal cord, onto the spinal nerves, creating a loss of bowel or bladder control. That's the second thing that we desperately do not want you having, as well as that saddle anesthesia. The third thing that we do not want is sciatica, so pain shooting down both legs. If you've got that pressure through there, creating pain, shooting down both legs, again, that's another red flag or something that we need to be really careful and looking out for to make sure that you've not got cauda equina syndrome. If you Google cauda equina syndrome, you'll find these three things: saddle anesthesia, loss of function of the bowel and bladder, and also pain shooting down both legs. There is, of course, on occasion where you will get sciatica down both legs, and it's not cauda equina syndrome. Because if you've got, for example, a bulging disc pressing up that side and pressing up that side, that's putting pressure on nerves either side, and of course you're going to get pain shooting down both legs. But as I say, if you've got these three things together, or any one of them, get things checked. Make sure you don't just leave the problem there. Having loss of bowel or bladder control, having loss of sensation in the saddle area is not something you want. Now, if you're happy that you've not got any of those symptoms and you want help with your back pain and sciatica, then make sure you click on these videos on screen or go to my profile page, watch the videos there. You're going to find loads of exercises to help fix your back pain, fix your sciatica, and get you feeling and moving back to your best.